Welcome to the Home Health Virtual Training Program. I'm Lisa Newton, and I'll be presenting the training program overview, which describes the design and expectations for each of the training components, Part 1 and Part 2. I'm a registered nurse with experience in direct patient care, clinical education, and nursing administration in the acute and post-acute care settings. Currently, I'm a senior staff associate at Econometrica in Bethesda, Maryland. Let's begin by reviewing the learning objectives for this session. At the conclusion of this training, participants should be able to understand the design of the Home Health Virtual Training Program, Part 1 and 2, describe the standardization of patient assessment items in the post-acute care or PAC setting, identify the new and revised Outcome and Assessment Information Set, or OASIS-E, items effective January 1st, 2023, and summarize the OASIS-E training and implementation objectives for your agency. I'd like to take a moment and review the disclaimer for this training. The presentations in this training program were current at the time they were published or uploaded onto the web. Medicare policy is subject to change, so links to the Home Health Quality Reporting Program, or QRP, web pages have been provided as supplemental resources for your reference. This training program was prepared as a service to the public and is not intended to grant rights or impose obligations. The training content may contain references or links to statutes, regulations, or other policy materials. The intent of the information provided is to be a general summary and not to take the place of either the written law or regulations. We encourage readers to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their contents. Next, let's review the structural design of the Home Health Virtual Training Program. It is highly recommended that this overview presentation be reviewed first. The overview provides a basis for your understanding of the entire Home Health Virtual Training Program and contains foundational material that is not provided in other presentations in the training. Reviewing this material first will provide you with key insights that are necessary for a more complete understanding of the program content. The Home Health Virtual Training Program consists of two components. The first, Part 1, is a series of recorded presentations that provide the didactic component of this training. An explanation of the new items and updated guidance for OASIS-E is presented. Item intent, rationale, response-specific instructions, coding instructions, and coding tips for select standardized items are explained. These didactic presentations are available for review at your own pace and can be viewed as many times as you would like. It is essential that the presentations in Part 1 are reviewed in advance of attending the coding workshop sessions in Part 2 of the training program. This will allow you to come to the coding workshop as prepared as possible to maximize your learning. An example is the Home Health Capstone case study, which requires some advanced preparation in Part 1 before attending the coding workshop. Here is a list of the recorded presentations in Part 1 that provide the didactic component of this training. As noted, we recommend that the training overview presentation be reviewed first. The other presentations include social determinants of health and new items for Section A and B, Section C, cognitive patterns, Section D, patient mood interview and total severity score, Section GG, summary of guidance changes, Section J, health conditions, Section K, swallowing and nutritional status, Section M, skin conditions, Section N, medications, Section O, special treatments, procedures, and programs, and the capstone case study. We also recommend that the case study be completed last, as it provides you with an opportunity to apply the coding concepts presented in the other recorded sessions to the home health scenario presented. The remaining presentations may be completed in any order. Part 2, the second component of the training program, is a virtual live event consisting of a series of coding workshop presentations corresponding to the training topics presented in Part 1. During this event, you'll have an opportunity to apply concepts related to the new and updated guidance for OASIS-E by reviewing a variety of clinical coding scenarios and responding using a live polling format. In addition, a recorded version of each coding workshop will be made available for your review and reference after the initial workshops are held. This is a list of the coding workshop presentations that will be reviewed during the virtual live event. As I noted earlier, these topics correspond to the didactic recorded sessions in Part 1 of the training program. Part 2 of the training program also includes 2 additional sessions: the question and answer session, which will be based on questions submitted from providers, and the listening session with CMS. Let's move on and discuss one of the foundational elements of this training, the concept of standardized patient assessment data, and why this is important in post-acute care. The basis of this is the IMPACT Act of 2014. The IMPACT Act is also known formally as the Improving Medicare Post-Acute Care Transformation Act. It is a bipartisan bill that was signed into law by President Obama on October 6, 2014. The act requires the collection and reporting of standardized patient assessment data with regard to quality measures and standardized patient assessment data elements across post-acute care. As you may be aware, each PACS setting uses a different instrument for data collection. Let's review each one as noted on the slide. Moving from left to right, we have the Inpatient Rehabilitation Facility Patient Assessment Instrument, or IRF-PI, used by the IRF setting, the Minimum Data Set, or MDS, used by skilled nursing facilities, the Outcome and Assessment Information Set, or OASIS, used by home health agencies, and the Long-Term Care Hospital Continuity Assessment Record and Evaluation Data Set, or LCDS, used by the LTEC setting. Historically, PACS settings collected similar information on their respective assessment instruments. However, variation between settings has made cross-setting comparisons and interoperability of data difficult. This concept is demonstrated by depicting the item eating using different types of fruit for each PACS setting. The item is assessed in each setting, but done so differently. The collection of data in a standardized manner facilitates outcome comparison, data interoperability, and comparison of quality within and between PACS settings. Here we see the example of the item eating that is now collected in a standardized manner in each PACS setting, represented uniformly by the same piece of fruit. Standardization is very important for a few reasons. It enables cross-setting data collection, outcome comparison, data interoperability, and comparison of quality within and across PACS settings. Standardization also improves outcomes for Medicare beneficiaries through shared decision-making, care coordination, and enhanced discharge planning. So what does this mean in relation to the OASIS-E? New standardized items are being implemented in the home healthcare setting toward the ongoing goal of standardization and cross-setting alignment. These changes will become effective on January 1st, 2023 with OASIS-E. It is important to note that the January 1st, 2023 implementation of OASIS-E represents a 2-year delay from the original compliance date finalized in the calendar year 2020 Home Health Prospective Payment System, or PPS, final rule. This delay accompanied additional OASIS flexibilities that CMS provided to support home health agencies during the COVID-19 public health emergency. This is found in the calendar year 2019 Home Health Final Rule, effective January 1st, 2020, as noted in the citation on the slide. With OASIS-E, effective January 1st, 2023, the items that were made optional with OASIS-D were removed from the specified time points. Now let's review some of the changes that will occur with the implementation of OASIS-E. OASIS-E is a major revision to the OASIS instrument and guidance manual, resulting in significant instrument redesign and manual reorganization. In response to the Impact Act, in order to align the items and guidance across the PACS settings, multiple new standardized items have been added to OASIS-E, new sections have been added or renamed, items have been reorganized within the sections, and the format for item-specific guidance has changed. You'll find Chapter 3 of the OASIS-E Guidance Manual extremely helpful, as it provides an item-by-item guide to the OASIS assessment instrument. Let's briefly touch on the organizational structure of the manual. In Chapter 1, you'll find an introduction to the OASIS manual, including the manual's purpose, structure, content, and description of the OASIS requirements and conventions. The manual summarizes the statutory authority for OASIS data collection and provides background on the development of OASIS and its version history. Chapter 2 describes the importance of data accuracy and how home health agencies may audit OASIS data to minimize errors. This chapter also briefly describes OASIS data correction and implications for reporting. Chapter 3 provides item-specific guidance subdivided into sections. The appendices in the OASIS-E Guidance Manual also provide a wealth of helpful information. Appendix A contains a glossary and description of common acronyms. Appendix B provides a listing of OASIS items and time points for data collection. Appendix C contains the OASIS instruments. Appendix D provides a description of changes from OASIS-D to OASIS-E in the form of a table. Appendix E provides additional references and resources, and Appendix F contains information regarding OASIS and quality improvement. Let's review the key changes that have occurred in the OASIS-E Guidance Manual. Item-specific guidance has been included for all new items introduced in OASIS-E and for those retained from OASIS-D. Each section begins with a brief introduction describing the items contained. Sources of information are now located in the first bullet under response-specific instructions. As a result, the Data Sources Resources section has been removed. Dash language has been added to each item, indicating whether a dash is an acceptable response or not, and general formatting and organizational changes have been made to improve clarity and remove redundancy. As a result, content has been updated with gender-neutral language. This is a snapshot of the OASIS-E sections and titles. This table can serve as a helpful resource as you become familiar with the new structure for OASIS-E. The OASIS-E is organized in a standardized section format for ease of review. Where appropriate, the order of information for the items in each section are presented in the following manner. The section begins with the item display, which is a screenshot of the item from the OASIS-E instrument. The intent provides the reason or reasons for including the item. Time points that the items are completed provides information regarding when the item is to be collected during the patient's home health episode of care. Item rationale explains the purpose, meaning, or importance of the item and the reason why the item is needed. Response-specific instructions are general instructions for how to complete the item that apply to most, if not all, situations. They include an explanation of how users are intended to collect information to complete the item. Coding instructions provide additional information to supplement the instructions found in the data element. Coding tips provide information regarding any special situations, outliers, or uncommon scenarios, or any tips to clarify confusing or equivocal circumstances when coding each OASIS-E item. And lastly, examples provide further illustration to help apply the coding concepts in the section. Let's review how the OASIS instrument has changed. New sections and items are added. There are different time point versions of some items. Some items have been removed or revised, and skip patterns have been updated. In order to have a full understanding of these changes, please refer to the introduction in Chapter 3 of the manual, as well as Appendix D, for a more detailed summary of the instrument and guidance changes. Appendix D contains the change table, which is a very helpful resource to quickly guide you regarding what is different. The change table outlines the revisions to the OASIS-E instrument as compared to the previous OASIS-D instrument. The table identifies the item section, the item number and description, again comparing OASIS-E to OASIS-D, and the exact nature of the change is described. So for example, is it a new item? Has the item text been revised? Was the skip pattern changed? And a description of the change is also provided. Please take the time to access and review Appendix D to help your understanding of OASIS-E implementation. A summary of substantive guidance changes from OASIS-D to OASIS-E is also provided in Appendix D. It's important to remember that at times CMS provides new or refined OASIS coding instruction. When guidance changes occur, the newer guidance supersedes previously published guidance, and providers are directed to utilize the most recent guidance. Examples of the more substantive guidance refinements that have been added to the OASIS-E guidance manual are summarized in Appendix D. We also encourage you to do a focused review of Chapter 3 in the OASIS-E manual to gain additional context and details regarding these and other guidance refinements that have occurred since OASIS-D. An important change in OASIS-E pertains to physician orders and allowed practitioners. References to physicians have been amended in the Home Health Final Rule to include allowed practitioners. The Act citation is noted on this slide, and the amendment allows nurse practitioners, clinical nurse specialists, and physician assistants to certify eligibility and provide orders for home health services where not prohibited by state law. So accordingly, when coding OASIS items, where the presence of a physician order affects the item coding, orders from these allowed practitioners would satisfy the condition of having a physician's order. Please note the first sub-bullet on the slide states the allowed practitioners who may certify eligibility and sign orders were not prohibited by state law. Each provider should know and understand the limits on each discipline's scope of practice for the state in which they practice. Whenever state, federal regulation conflict, the more stringent shall apply. Therefore, if state regulations, scope of practice, say that an APRN or PA cannot sign orders, certify the plan, regardless of the federal rule, they cannot. Additionally, a home health agency must ensure that providers are in compliance with all federal regulations in states that may have more lenient scopes of practice than what is required under federal law. Another important update involves the start of care or SOC comprehensive assessments. Effective January 1, 2022, occupational therapists may conduct the SOC comprehensive assessment, including OASIS for Medicare patients, when the physician's referral order does not include skilled nursing, but does include physical therapy and/or speech-language pathology along with OT. It's important to note that the services which establish eligibility for the Medicare home health benefit include skilled nursing, physical therapy, and speech-language pathology. The change allowing occupational therapists to conduct SOC comprehensive assessments did not alter Medicare's criteria for establishing initial eligibility. That is, the need for occupational therapy does not establish initial eligibility for the home health benefit. Again, providers should confirm that they are practicing within the guidelines of state law as well as complying with federal regulations. Throughout the home health virtual training program, we've established and used a variety of conventions to enhance the training. Let's review how these conventions can be helpful in guiding your review of the material. First, all the acronyms used throughout the presentations in the home health virtual training program are available in a companion PDF that can be downloaded from the training platform and used as a reference throughout the program. Also, throughout the presentations, different formatting conventions are used to identify changes to guidance. Blue text is used to identify revised or new guidance, and blue strike-through text is used to identify words or short phrases that were removed from the guidance. In the last bullet on this slide, we have an example of both conventions being used to demonstrate this. Reference icons are strategically placed throughout the presentations to assist you in more easily understanding how to apply the content. A star-shaped icon with the word new in the center is used to indicate that the guidance on the slide is new. Rectangular icons are used to help identify whether the guidance has been revised or updated. Throughout the training program, coding scenarios, examples, video vignettes, and a case study are used to assist participants in applying the concepts related to the new and revised guidance. For instructional purposes only, gender has been designated to represent agency patients, family members, and staff in the case study and any coding workshop presentations that use video vignettes. We have also provided additional supplemental materials to assist your understanding of the presentations. These materials are available by selecting the respective tab in the event platform. The materials include slides for each presentation, an acronym list, the action plan template, which will be described shortly, documents to complete the case study, the OASIS-E instrument, and you'll want to have this available for reference during the coding workshop, and a list of home health training resources and links. Now let's talk about how you can make this training as meaningful as possible in relation to your specific agency. Action planning is one way to help translate the training materials into action steps for your agency. We've created an action plan template that corresponds to each session in the training. You can use it to take notes and record your thoughts and ideas and identify processes that may need to change at your agency in response to the new or revised guidance in the OASIS-E. This may include things like authoring or revising policies and procedures, training and education for your staff, and possible enhancements to information technology at your agency. Here's a screenshot of the action plan. We've pre-populated an example with some ideas to help you get started using the tool. The action plan is set up as a template with a separate page for each training session and blank columns for your notes. So if we look at the example of the template on this slide, moving left to right, the first column on the left identifies the training topic or session. In the second column, you can list any policies, procedures, processes, or documentation systems or tools that may be potentially impacted at your agency. In the third column, you can record any action steps that may be needed to implement OASIS-E. The fourth column identifies any education needed, both the topic and the audience. And the last column outlines the target dates and timeline for completion. This tool can be personalized in whatever way is most meaningful for your agency, and we hope that you find it helpful. Another way to look at your implementation strategy is to see it on a linear timeline as a sequence of action steps. Moving from left to right, following the numbered steps, you would review the finalized OASIS-E guidance, identify the new standardized items, updated guidance, and the implications for your home health agency, identify any impact on information technology at your agency, develop an implementation plan to introduce the changes to your staff, and revise policies and provide education and training to ensure agency readiness for implementation on January 1st, 2023. Now let's take a moment to briefly review the Quality Reporting Program, or QRP, training resources that are available to you. The Home Health Virtual Training Program is based on the new OASIS-E guidance. Resources for both the OASIS-E dataset and the user manual are available by selecting the respective links on this slide. As noted earlier, we have also created a home health resource document that is available for download from the event platform, containing additional helpful information and resource links. Beyond this presentation, another helpful resource is the OASIS Q&A that is released quarterly. This is a very important resource as it ensures you have the most current information. OASIS Q&As are available in the OASIS Quarterly Q&A section of the CMS Keys Technical Support Office, or QTSO, webpage. The link is provided on this slide. And please remember that at times CMS provides new or refined instruction that supersedes previously published guidance. In such cases, use the most recent guidance. In summary, within OASIS-E, new items and updated guidance are being implemented with the goal of ongoing cross-setting alignment. These changes will be effective January 1st, 2023. The Home Health Virtual Training Program is designed to assist your staff in preparing for OASIS-E implementation. Part 1 of the program contains the didactic sessions focused on guidance, and Part 2 consists of coding workshops designed for knowledge application. We've covered a lot of information in this session, and you may find that you have questions about the content. If you would like to submit a question regarding this presentation, please send it to pactraining@econometricainc.com by August 31st, 2022. As a reminder, a practice coding workshop will be held in September, and we encourage you to attend. Select questions will be answered in a Q&A session during the September 2022 virtual live event. Thank you for reviewing this presentation, and we look forward to your attendance at the coding workshop.